of the uterus or uterine appendages are the structures most closely related structurally to its such as fallopian tubes, ovaries, uterine ligaments. Most of the adnexal lesions are benign. About 90% of the adnexal masses can be adequately characterized with ultrasound alone. With few specific exceptions, a solid component is the most predictive ultrasound feature of the malignancy in a cystic ovarian mass. So how will we distinguish various structures of adnexal area? With high resolution transvaginal ultrasound, transabdominal ultrasound, on the screen you can see an ovarian cyst. It has got a thin wall, clear fluid inside, no septations. It is a simple cyst. You can see this one is the simple cyst. This is different. This one is a complex cyst in which you can see that there are septations and fleshy component. This is cystic part, this is solid part. And there are septations and septa are thick and there is Doppler blood flow within it. This is a serous cyst adenocarcinoma, complex ovarian cyst with septum and a solid nodule. There is flow within the solid nodule, typical of malignancy. Another ovarian cystic mass, you can see turbid content and an intensely echogenic portion in it. This one. This is typical of a dermoid cyst, which is a complex ovarian cyst with low level internal echoes and a markedly hyperechoic solid appearing area with faint distal acoustic shadowing. This is image of an ovary in which you can see a follicle here and then you can see a cystic area containing some fleshy tissue inside, having concave margins but no Doppler blood flow within that. This is typical of hemorrhagic cyst with a clot. Complex cystic mass with solid area within the cystic mass having concave margins. This is an ovarian cystic mass which is actually a corpus luteum, resolving corpus luteum with crenated irregular margins. Next is a mass, cystic mass, because you can see posterior enhancement here, and inside the content is turbid looking, just like a sandpaper or a ground glass appearance. This is typical of an endometriotic chocolate cyst. Complex ovarian cyst with homogeneous internal echoes with ground glass or sandpaper-like appearance. Has a small solid appearing area without Doppler blood flow. This is an endometriotic cyst. Another mass having thick septations with cystic areas and solid areas. This is serous cyst adenocarcinoma. Complex ovarian cyst with several thick septa and solid areas are seen. Color Doppler showed flow in the septa and solid areas. Next is a cyst having thin fibrinous septations which are incomplete. There is posterior enhancement and turbid looking appearance. This is typical of a hemorrhagic corpus luteal ovarian cyst. Complex cyst with internal echoes and fibrin strands or thin type which do not extend completely from wall to wall. You can see the septations. This is adjacent cyst simulating a septated cystic mass in a 38-year-old female. Color Doppler scan revealed flow within the intervening tissues. Such masses are need to follow up and screen for carcinoma. In this ovary, you can see an irregular cystic area with crenated margins. This is typical of a hemorrhagic cyst, and Doppler blood flow around it appears as a ring of fire. This is a corpus luteum cyst. Sometimes a hemorrhagic cyst will look like this, but no Doppler blood flow within the area where you can see a solid looking area, and it tends to resolve over a few weeks. Can anybody guess what is this? Looks like endometrioma. Yes, that's right. It's endometrioma. This is another type of cyst having intensely bright specks in it, typically diagnostic of dermoid cyst. A complex cystic ovarian mass. Portion of the mass consists of the fluid with hyperechoic lines and dots. Dermoid mesh. A hyperechoic solid appearing area, dermoid teratoma. This is an ovarian mass which is solid looking, and it's not a very good picture, but some other pictures you will see. This is an ovarian fibroma, having a fibroid-like appearance within the ovary. Ovarian fibroma. This is an ovarian mass having a fibroid-like structure. Ovarian fibroma. This is Adnexal area cystic mass, which is actually neither uterine nor ovarian. It is fallopian tube, dilated fallopian tube. You can make out the continuity of the dilated fallopian tube here. So sometimes extra ovarian, extra uterine masses are either can be uterine or can be the fallopian tube, dilated fallopian tubes. In this picture, if you analyze, this is the ovary, and there is an extra ovarian cystic area. These are called peritoneal inclusion cysts. A complex left adnexal cyst with septa. A portion of the cyst conforms to the contour of the uterus. The transvaginal ultrasound scan reveals a normal ovary at the periphery of the cyst. So this cyst tends to surround the pelvic organs, uterus or the ovaries. This is a solid mass, a pedunculated fibroid, exophatic subserosal, getting its blood supply from the uterus. It's a pedunculated fibroid. Here is a cyst with turbid ground glass appearance. The solid tissue didn't show any Doppler blood flow. Any guess? Chocolate cyst, endometrioma. Yes, that's right. And what about this one? Follicular cyst, that's right. It's not like endometrioma. The fluid is clear, the septa are thin. What about this one? Yes, that's right. It's hemorrhagic cyst. You can see the clot, retracting clot. This is rather more solid looking clot, and this is more fluid looking. And the blood flow in the rest of the ovary was intact. This is typical of the fishnet appearance of the hemorrhagic cyst. What about this one? Any guess? Another hemorrhagic cyst. This one? Dermoid cyst. But we have to watch about these solid looking areas. If there is blood flow, or if on follow-up these grow, then this can be a mucinous cyst adenocarcinoma. Mucinous. Because mucinous material also looks a little turbid. Okay. This one. This is fibroid. Fibroid with linear edge effects shadows. On one side, this is the uterus with fluid inside in one adnexal area. This was a case of ectopic pregnancy. Urinary pregnancy test was positive and uterus is containing pseudogestational sac. This is the ovary, and here is that mass. The ectopic pregnancy can also show the ring of fire sign. These are simple cysts in the ovary. Also fluid-filled cysts, thin-walled, follicular cysts. This is an ovary with intensely echogenic area and turbid contents. This resembles dermoid. Any guess about this one? You can see a uterus surrounded by turbid fluid. Can happen with rupture of the uterus and also infected and pus-like material inside there in PID. It was an abscess. On the one side, there is a cyst with some septation, and on the other side is the typical endometrioma. This is a picture of hemorrhagic cyst, an adnexal mass with bright areas with shadowing. Okay. Can anybody tell what it is? Dermoid. Dermoid cyst having such area with shadowing. This is typical of the dermoid. There was pregnancy, and in adnexal mass you can see intensely bright areas. Another case of dermoid. Typical of fibroids of the uterus. You can see the rest of the uterus is here. And from the fundus it's getting the blood supply, and this was a fibroid. Next slide, you can see urinary bladder and a large fluid-filled thin-walled cyst, unilocular. A posterior wall fibroid. Fibroid can have this look as well. This was a large cyst containing multiple septa and fleshy parts and turbid fluid inside. This was a mucinous cyst adenocarcinoma. Another large cyst, an ovarian cyst, unilocular, fluid filled. Sometimes if we miss the bladder here, then this can be labeled as urinary bladder. So we have to be very careful about it in diagnosing. Now everybody must be knowing this one. This is a dermoid. This is a dermoid with intense bright areas and shadowing. Another appearance of the dermoid cyst. This is exophatic fibroid projecting from anterior wall. Now you see a large ovarian cystic mass which is mostly solid and with few cystic areas. This is typical of a highly anaplastic, poorly differentiated ovarian carcinoma. Whenever the cystic part is too much and the solid part is less, that would be a well-differentiated carcinoma. And this one is highly anaplastic, rapidly growing, associated with ascites. There is ascites, turbid ascites. A case of endometrioma. This is an ovarian mass with multiple septi and fluid-filled cystic areas. Also a case of carcinoma, but it was well differentiated carcinoma of the ovary. What about this one? Having cystic areas and solid areas. And you can see blood flow in the septum. So this was almost medium differentiation carcinoma of the ovary. Doppler blood flow shows the high diastolic blood flow because the tumor vessels do not have media. There is only intima and adventitia. So these vessels do not offer any resistance. So there is a good high Doppler velocity blood flow in the diastole. Yes, this seems confusing, but actually it was hemorrhagic ovarian cyst with some leakage of the blood there. Sometimes these cases present with serious emergencies. The hemorrhagic cyst is a great mimicker. The dermoid cyst is also a mimicker. And the ectopic pregnancy have fooled many senior sonologists and gynecologists. One ovary is normal. This one is normal. This is dermoid. One appearance of dermoid. But sometimes a pelvic abscess will look like this one. So presentation is important. Patient will have high-grade fever and pain. This patient had ovulation induction for infertility, and this is ovarian hyperstimulation syndrome. Any guess about this one? Dr. Tahir Siddiqui sir. Dr. Musara. I think your angle of view is not very good. If I tell you that this is a kidney.
Saw sepsis.
Yes, now everybody. This is a saw sepsis. Huge saw sepsis, about more than 1 liter of pus inside. Intrauterine gestation and subchorionic bleed. But still the fetus, the embryo was alive. A malignant ovarian cyst, dermoid cyst. What about this one? Polycystic ovaries, typical. With necklace ring like pearl of bead surrounding the periphery of the ovary with increased amount of central stromal tissue. You can see intrauterine fetus, and on one side you can see what would this cyst be called?
Corpus.
That's right. This is a corpus luteal cyst with some hemorrhagic component. You can see the fishnet appearance there or clot. This is a malignant ovarian cyst. And sometimes an ovary can have endometrioma as well as a complex cyst. So both types can be in one ovary. This one is hemorrhagic ovarian cyst. What about this one? Concave margins, turbid fluid, fishnet appearance, hemorrhagic cyst. Another view of the same hemorrhagic cyst. Ovulation induction was given. This is ovarian hyperstimulation syndrome. Another dermoid and a chocolate endometrioma cyst. Another endometrioma, a simple cyst, a hemorrhagic cyst will become heavier and tend to fall into the center of the pelvis. This is uterus. There is a fleshy tissue coming out of the cervix and surrounding all these areas. This was a case of endometrial carcinoma. This is a very solid tumor, highly anaplastic ovarian tumor. Here you can see the recurrence, जैसे कंघी के दंदाले, just like that. These are the fibroid, pregnancy with fibroid, endometrioma and a normal cyst. This here you can see a malignant ovarian cyst with turbid fluid, mucinous cyst adenocarcinoma. A chocolate cyst and other ovaries hyperstimulated. Last few slides of uterine trauma, sometimes during instrumentation. Here you can see the anterior wall is ruptured and there is an hematoma adjacent to the uterus. Hematoma at the C-section. Rupture of the uterus. These last few slides have been sent by Dr. Duresadi from Multan. Trauma. There is the increased amount of Doppler blood flow in AV malformation area, subendometrial AV malformation, anterior wall hematoma.